So we have 6 lifestyle pillars in our bone optimization pyramid. And without a doubt, nutrition is probably the most critical. You can have everything else dialed into your bone health program, but if you don't have the building blocks of muscle and bone, you're not going anywhere. So this is my 4th yearly update to our nutrition recommendations on our YouTube channel. My team and I are always learning and updating our protocols based on research and our own clinical experience. In this video, I'm going to give you our 2025 update on our approach to nutrition and bone health. And if you're on a bone health journey, this is a must watch because again, nutrition is probably the most important thing you can focus on. And it's the one thing that all of us share in common that we need to do. If you find value in this content, if you could just do me a favor, just click the like and subscribe buttons. And that's going to let YouTube know that you're interested in this video, and it's going to put this video in front of other people who have similar interests, likely bone health and longevity. Okay, so the nutrition recommendation is really centered around one thing. And we're going to talk about multiple approaches here, but the one thing that I want you to focus on is being protein forward. Without a doubt, the most important component of our diet to improve muscle and bone is to be protein forward. This is more important than calcium, more important than vegetables, more important than the pH of your food. In fact, if you think that last part is the most important, please don't stop watching or listening to this because this information will absolutely change your life. So if we're going to build muscle and bone, we need the building blocks of muscle and bone in our diet. That's protein for both. Now, we know that muscle is mostly made up of protein, but by volume, so are our bones. And yes, they need minerals, and we'll get to that, but we first need the structure in place, the framework in place to put the minerals on, and that comes from, you guessed it, protein. So how much protein? Well, I've presented data on this before, but I recently did a talk for A4M at their Longevity Fest, and I went deep into the research on this. So I want to just go through some of that work because I think it really helps to paint the picture of why we need quote unquote so much protein. Because if you look at the literature, what we're recommending is actually right in line with what the up-to-date recommendations for muscle protein synthesis and building muscle really show. So if you go back to the origins of our recommendations for protein, you see that this 0.8 grams per kilogram of body weight per day of protein intake is based off of nitrogen studies that were not based off of any clinical outcomes on human studies. So this was simply just laboratory data, what happens when you consume protein to humans and what are their kidneys doing. And you can get this threshold of 0.8 grams per kilogram of body weight per day. That would indicate that there's a minimum need met there. But that need is certainly not optimal. In fact, the second study here shows that even these same authors knew that this wasn't enough for older individuals. So there was clearly a range that was going to extend above that. But for a long time, there was no discussion of what optimal was. People were afraid to get over 1 gram per kilogram, which is less than a half a gram per pound of body weight. But as you fast forward in time and you look at other bodies of literature on, say, like muscle building, bodybuilding, people who are recovering from injury, you can see like in this third study here that there's a threshold more like 1.6 grams per kilogram, which is about 0.8 grams per pound. In fact, this fourth study here actually shows that you can push that up to 3 grams per kilogram, which would be like 6 grams per pound, right? Which is a lot. And you can continue to see improvement in muscle protein synthesis. So clearly it's more than 0.8. The most recent meta-analysis I have here again shows that 1.6 grams per kilogram of body weight is pretty consistent. But when it comes to bone health, we have to ask ourselves some questions because all that literature that I just cited is all about muscle mass. It's all about building muscle protein synthesis. And there's some challenges with that literature because they're always talking about kilogram of body weight, which especially in our population of individuals with osteoporosis and sarcopenia, they tend to be underweight. Now, this could also be the wrong direction for people that are overweight and obese, but we have to take the body of literature that we have to put it in context. And so if you look at the bone health literature, so there are not as many studies, but this study that I have here is actually one of the better studies that shows that if you divide people up into the amount of protein that they consume on a regular basis, you can see that the highest protein consumers have the most bone mineral density. So there is a linearly positive association between protein intake and bone mineral density, and there doesn't seem to be a ceiling on that but I doubt anybody in these studies were consuming very large quantities of protein because this is a general population study. Okay, so what am I recommending now? Well, I like the 1.6 grams per kilogram if everything was in a perfect world, which of course it's not. But that number represents the threshold that we need to hit to optimize muscle protein synthesis. But if you have osteoporosis, if you have sarcopenia, my guess is that you probably don't have perfect digestion. You probably are struggling to hit those protein goals. So should we aim for that bare minimum? No. I think we should aim over that bare minimum. We don't want to overshoot it, but somewhere around 2 to 2.2 grams per kilogram of body weight per day is where we like to see our patients at least start. Now, that's more simply said 1 gram per pound of body weight, but that allows a little bit of room for digestive challenges, for inadequate hydrochloric acid in your stomach or pancreatic enzymes. It just leaves us a little buffer. If we just aim for the bare minimum, we're going to fall short, and we see it time and time again. So the other thing we need to mention here is that I mentioned our population of patients and followers and OSTEOCOLLECTIVE members tend to be underweight. So if we talk about grams per kilogram or pound of body weight, we might actually be undershooting this as well. Now, this is also true for those that are overweight. We don't want to overshoot our protein recommendations to talk about body weight. We want to talk about ideal body weight. Now, there's a couple of different ways to do this. There's the Divine formula. There's a bunch of different formulas out there. They tend to all undershoot anyway, but you can pick the one that you like or that your dietitian likes, and you can find a number that makes sense. So for people that are underweight, we need to go up a little bit. For people that are overweight, we probably need to come down. And once you do that, then you can find your ideal body weight. Once you know your ideal body weight, then 1 gram per pound, again, is our starting recommendations. Okay, so there's 2 concerns that then come forward with this. Number 1 is, what about my kidneys? Totally hear you. So I was trained as a doctor when going through medical school that too much protein is bad for your kidneys. But I can tell you that as I've looked through the literature, if you have normal functioning kidneys, meaning you don't have chronic kidney disease, then you can tolerate well beyond 3 grams per pound of body weight, actually, the literature would support, which is more than any of us are likely to consume. So as long as you have good functioning kidneys, they've been tested, you don't need to worry about that. Now, if you truly do have chronic kidney disease, then this is a conversation with your nephrologist to see what your protein tolerance could be. Even in the circumstances of some cases of chronic kidney disease, you can actually still consume what we'd consider to be optimal levels of protein. Now, the second one is the alkaline theory of bone health. So if you're consuming a protein-forward diet, doesn't matter if this is coming from animals or plants, actually, but if you're consuming a protein-forward diet, some people would be concerned about the nitrogen base of these molecules that are coming in protein, and that this is going to create acidity in your blood, and this is going to break down your bone. I'm not going to go in depth here on this. I'm just going to say that I have multiple videos on this topic that debunk this theory and that we need to worry about protein first. There is one thing I'm going to adjust on that, though, and you have to wait till the end because I want to circle back to this, and I want to talk about one study that really did change the way that I view this theory of alkalinity. But in general, we need to focus on protein first. And if you're going to focus on one thing, let's say you don't want to track your food, you don't want to, do the extensive work to optimize your nutrition, then I would ask you to do one thing, and that is to track your protein. If you don't know how much you're getting, that's all you need to track. Understand if you're getting around 1 gram per pound of ideal body weight. That one thing alone will have a massive impact on most people's nutrition. Okay, so once that's dialed in, what's the next thing to worry about? Well, I would argue overall quality and nutrient availability and source of those nutrients. I like to describe this style of eating as a whole foods, protein-forward, nutrient-rich diet, which is not a catchy name. I could never write a book with that on it. But basically it means eliminating or limiting as much as you can highly processed foods and getting good quality foods. If you're stuck in the highly processed food world, you are consuming foods that are designed to be calorically dense and nutrient poor. They're often made with subpar ingredients like processed GMO grains, added sugar, food additives, color, dyes, etc. We can just avoid all of these things by cooking and preparing most of our foods and eating as many single ingredient foods as we can. What do I mean by single ingredient? So for example, for breakfast this morning, I had 5 eggs. The ingredients in that dish was number 1, eggs, and that's it. So that's what I mean, single ingredient foods. If I'm going to have ground beef, I'm going to mix it with some spice, but I'm not going to put much else in it. I'm not going to bake it into lasagna. I'm going to have ground beef. single ingredient foods. Okay, last thing on protein. So I just recently did a video on plant protein versus animal protein. And the reason why I put that out there is that there is an abundance of evidence to say that if the majority of your protein is coming from plants, that you are likely to have lower bone mineral density, you are likely to have a higher fracture risk. The challenge here is that you need all of the amino acids, the essential amino acids from animal proteins to fuel your body. Whichever one of those you're missing from an incomplete protein, which is what most plant proteins are, can be a limiting factor. Now, it's possible to consume a plant-forward adequate protein diet, but it is much harder and it requires more protein. So the numbers that I was speaking about earlier, those numbers are for a mostly animal protein diet. If you want to consume plant proteins, totally fine. You just need to make sure that you're getting all the essential amino acids, you're mixing and matching to make sure that that happens. And then you're going to probably want to overshoot by somewhere around 20 to 40%. So if your goals were 120 with 1 gram per pound, I would shoot upwards of 140, 150, because that's how much the inefficiency and the challenge of digesting the plant proteins is. Okay, so let's get into micronutrients. So the best source of micronutrients outside of animal products, because there are lots of micronutrients there, but the best source outside of that is going to come from vegetables. So my favorite low anti-nutrient veggies are these. So number one is broccoli. Now, I like it steamed. Broccoli is really rich in antioxidants and phytochemicals like sulforaphane, as well as other compounds. But these things can support detox and protect cells from oxidative damage. From a bone health perspective, broccoli is high in vitamin K1 and plant-based sources of calcium, as well as vitamin C. So number two that we're going to have on a regular basis is cauliflower. Now, for cauliflower, I prefer to bake it. I just like the texture of how it tastes baked. From a nutrient perspective, it is anti-inflammatory because of these things called glucosinolates. They also have these other cool things called isothiocyanates. Super fun to say. But these things are inflammatory. Cauliflower also can help with gut health. It's high in fiber, aids in digestion, feeds beneficial gut bacteria. It's packed with vitamin C, more vitamin K, B6, and other minerals. So make sure you're getting organic, comes from a good source, but broccoli and cauliflower. Now, number three might sound kind of silly, but I like lettuce. I like lettuce because it gives especially my colder dishes, gives them some fiber, it gives them just a little bit of hydration, gives you a little water content. The fiber in this can really help with digestion. I eat a mostly animal protein diet, and most of my calories actually come from animal proteins too. So I'm always looking for sources of fiber to help me out. Lettuce also contains small amounts of folate, vitamin C, vitamin K. It's also very low in calories for people that are concerned about that. Has some other cool things too, including potassium. There's some thought that lettuce can help actually control blood pressure because of that. So lettuce, even though it looks like it's just fiber and water, actually has some other benefits. The last one I'm going to mention here is mushrooms. So I actually like to pan saute my mushrooms, cook them either in ghee or tallow, or my wife will cook them in avocado oil. So the nice thing about mushrooms is they're really rich in nutrients. They have beta-glucans. They're actually a plant source of vitamin D, which is pretty rare. They have some cancer-fighting potential with compounds like ergothioneine, and selenium is going to help with thyroid health, and they're also thought to reduce oxidative stress. So mushrooms can be a nice addition to, for me, especially like a steak, chopping them up, putting them in ground beef. I think they are a really nice addition. I really like the texture there. So the third best source of micronutrients, in my opinion, is fruit. So fruits are meant to be consumed by plants. So they have less anti-nutrients than do vegetables, but they do have more sugar. So depending on your metabolic health, this might not be a primary source of food for you. But if you are metabolically well and can tolerate the glucose and fructose, then fruit can be a really, really good source because there are some unique things to fruit that you don't actually get in most vegetables. Okay, so what are my favorite fruits? So number one is going to be prunes. Now, I personally don't eat prunes, but prunes are very popular in the bone health world because they are rich in a number of things that can help bone health. So they have potassium, which is great, vitamin K, and a high amount of boron. So if you look at the research on prunes, you can see that they are actually individually listed as an intervention that will improve bone mineral density. Now you have to eat about 50 grams of prunes to do that, which is about 5 or 6, depending on the size. The studies used either 50 grams or 100 grams. So I don't know who's out there eating 10 prunes a day. I think that's going to have a potentially very negative impact on your gut health. But we do know that prunes can help to improve bone mineral density and probably bone quality with the boron, but you can only consume what you can tolerate otherwise. All right, so my second favorite for bone health and my personal favorite fruit is apples. So I really like apples because they're filling, they're high in soluble fiber, particularly pectin. They have prebiotic fiber, which is also great for the gut, and they're a great source of low glycemic index carbs for those that can consume and tolerate that amount of carbohydrate. So hands down, the most antioxidant rich fruit is going to be berries. So this is blueberries, strawberries, raspberries. Just make sure that these are organic, because the thin skin nature of berries is going to allow them to absorb more of the pesticides, glyphosate, whatever is being sprayed on them. So make sure that they're coming from a good source. They definitely need to be organic. But berries contain high levels of anthocyanins and vitamin C. And again, they're reducing oxidative stress because of the antioxidants. They can reduce inflammation. They've been shown to support neurovascular health, vascular health in general, cardiovascular health, and immune health. So berries are a great tool if you can tolerate, again, those carbohydrates. Bananas are actually becoming one of my more popular fruits to eat as well. Again, for those that can tolerate the carbohydrate, but the pectin and resistant starch in bananas is pretty unique. And they have a relatively high amount of potassium, which of course they're known for. So it's another area where you can see some benefit for bone and other things. Kiwis are also another fun fruit. So they have really high amounts of vitamin C. So this can be great for your immune system, for your bone, for your collagen, and cartilage. So kiwis are another fun fruit to consider there as well. So I could keep going on and on. Our patients and TOC members have resources of long lists of fruits and veggies. These are just my favorite, whatever, 4 or 5 to get you going. All right, next topic, dairy. So before you turn this off, hear me out. I think a lot of people are missing the big picture on dairy, and I don't want to miss the forest for the trees here. I've published videos on these common misconceptions around dairy in the past, and there's some influencers like Dr. Mark Hyman, who I love his messaging, but he really has a negative viewpoint on dairy, for sure. Talks bad about ice cream all the time. There are comments that are made by Dr. Hyman and others like this. The comments go, 1 glass of dairy will increase your risk of fracture by 9%. And while I've read the study that comes from, I know where they're getting the statement, and it's not false, but we need to understand the context of that, of those data points. And that one in particular is talking about childhood consumption of dairy, and it has to do with the height that is generated as a result of consuming dairy, not the dairy itself. So we need to take this into consideration. But I also want to point out the massive number of studies that show that dairy can be beneficial. And then I want to talk about some of the dairy products that are tolerated, especially when you can't tolerate milk. Because let's face it, a lot of people can't tolerate consuming milk. But before we get into that, let me just talk about kind of the challenge around dairy. Because I hear this feedback that people will say, well, I don't want to consume dairy because it's unnatural. And you're absolutely right. Consuming dairy as an adult from another species is absolutely unnatural. No question, right? We're the only species that consumes dairy under those circumstances. But I also want you to remember that a lot of things that we do are unnatural. So it's unnatural for us to be in front of big, bright blue lights. It's unnatural for me to consume supplements in the form of capsules that are trying to, mimic eating real foods. It's unnatural for me to sleep in a bed. I should be sleeping on the ground with my head on a rock. Like, there's a lot of things that we do that are unnatural that help us to optimize our health. And dairy can be a tool for some people. It's not for everybody. And I don't want you to miss the opportunity to use dairy because, yes, it is unnatural, but it has some unique nutritional benefits that you're not going to find anywhere else. Okay, so let's get into some of the data. So this study that I have here is a 2022 meta-analysis. And what they looked at here is adding milk, quote unquote, supplementation, they gave milk, to an older adult population. And what they saw over the course of 6 months is increased total hip and spine bone mineral density. They also measured my favorite bone turnover markers, and there was an improvement in both the ratio and the absolute numbers of P1NP and CTX, and parathyroid came down and IGF-1 went up. So those are biomarkers we use in our practice, and I can tell you that those are the direction that you want those things to go. So That's a pretty interesting study showing the biomarker benefit as well as what we're looking for in bone mineral density. So pretty cool. Now, this next study was a great review of all the negative observational studies. And they basically pointed out that dairy is a unique food. And this is one of the big things I wanted to get across around dairy, is that there's no other food in nature that is high in dietary fat, high in protein, and high in carbohydrates. Dairy is designed to make little animals get bigger faster. So we can expect that it's going to have the same impact in adults. This is why I do not recommend using dairy if you're trying to lose weight. But if you're trying to build muscle and bone, that increase in IGF-1, that increase in the bone turnover markers in a positive way, those are all things that we're looking for that dairy can help us with. Now, this next study, study 8 here, is a 2021 randomized control trial. And again, this is in older adults. So this is the population that we're really interested in because we're going to see bone mineral density drop and we're going to see fractures. So what's interesting about this study is that they added some very specific amounts of dairy. So they added dairy that was equivalent to 562 milligrams of calcium, 12 grams of protein, and they made sure that these participants were getting 1.1 gram per kilogram of body weight of protein in their diet. So, okay, cool. So that's the intervention group. Now, the control group was getting 700 milligrams total calcium, which is significantly less than total calcium in the other group, and then only 0.9 grams per kilogram of body weight. Now, I wish they had sort of pushed those two apart a little bit more. 1.1 to 0.9 is not a big difference. But even so, after 2 years, there was a 33% reduction in all fractures, a 46% risk reduction in hip fractures, and 11% risk of reduction of falls. So, I mean, that's a pretty big drop. Now, of course, we're talking about relative risk, so absolute numbers are smaller, but still, it's an impressive number. We saw the significance in that study hit at 5 months for hip fracture and 3 months for falls. So you actually see a difference pretty darn quickly. So in these studies, you can definitely tell that dairy as a source of protein, as a source of growth factors, as a source of dietary fat, did these participants some good. Now, one of the challenges we see with dairy is that not all dairy is the same. So if you go to the grocery store, you walk down the aisle, you're going to see pasteurized dairy. What's going to be up front is the low-fat dairy products coming from conventional cows. It's what's going to be cheapest. And this is wildly different than fermented dairy from grass-fed cows and definitely raw dairy, which is a whole different story altogether. So this next study looks at specifically fermented milk products. Now, this meta-analysis compiled data from over 100,000 participants and again showed a 33% risk reduction with more yogurt consumption, so fermented dairy product. They also looked at cheese. Cheese didn't have as great of an impact, but again, remember that we have to understand we can only study what we're studying. And if they're just looking at what's defined as cheese, not all cheese is cheese. So like American cheese, the thing you get in the little wrapper, that's not cheese. So probably you could redo this study and look at different cheeses, fermented and aged cheeses, which are probably going to have a better impact, but of course, we don't know. So the research goes on and on. I could keep showing you studies, but I think we got the point. This last study is a 2020 meta-analysis that shows a positive association with dairy consumption and bone mineral density in postmenopausal women. And I've got 2 more studies here, so the list again just goes on and on and on. But dairy is not a magic bullet for bone health because not everybody can tolerate dairy, even if it's fermented dairy, even if it's, aged cheese. There is an immune reaction to not just the lactose or the sugars in dairy, but also to other things like casein. There's other proteins in dairy which are not as well known. So some people just don't tolerate them. Sometimes you can improve the gut and you can improve that tolerance, but sometimes you're just not going to be able to tolerate dairy, and that's okay. But some things to consider is that if you are struggling with some forms of dairy, like especially milk, switch to other types of dairy that have less lactose. If it's conventional dairy that you're struggling with, you could consider A2 rather than A1 casein dairy. You can consider, the fermented products like yogurt and kefir. Again, aged cheeses. You can consider other animals like goat and sheep. There's just so many ways to consume dairy. And a lot of times we can find 1 or 2 that are going to work for somebody. Cottage cheese is another great choice that I love. So I think that if you are open to it, I would encourage you to consider dairy. It is not for everybody, but it can be powerful. So my personal favorites are raw A2 cow milk or goat milk, full-fat cottage cheese, full-fat Greek-style yogurt, and raw aged cheeses. So I consume, not a lot, but a fair amount of dairy. And I do find that for my kids too, it's a great way to get them protein. It's a great way to get them dietary fat. It is a whole food, and especially if you're getting it from a good source, and then it's something you really should consider adding to your diet. Okay, so what have we not discussed? We have not discussed grains. I didn't mention it once. So in the US, most of our grains are GMO. They're genetically modified. They're sprayed with glyphosate or other pesticides. And as a whole group, they just tend to be inflammatory and they're just unnecessary. So I personally avoid them. My family consumes them. I'll talk about some potential options, but in general, I avoid them. I recommend my patients avoid them. But does that mean everybody does? Of course not. Grains are consumed across different cultures for different reasons. So lots of our patients are not willing to give up grains. And that's okay. We have some recommendations here. So some of the companies out there that are using they'll call them ancient grains, or they're using grains from Europe, or they're actually Italian companies. These companies like Jovial, you can get some of these things that are unadulterated. They've been the same. It's the same thing that they've been growing for generations, and you can actually do well with some of these things. I recently traveled over to Croatia, and when I was in Croatia, I could eat the grains over there, and I didn't feel inflamed or bad at all. So it's definitely possible to consume it, especially in other areas of the world. If you're in the US, some other grain alternatives might be things like organic rice, gluten-free oats. There are ways to get this into your diet. It's just my personal preference to avoid them because I just don't find them to be necessary personally. So then what about beans, legumes, seeds? I've been talking for I don't know how many minutes now. You can tell how much I just don't think that these things are necessary. There are micronutrients and fiber. There's definitely some potential benefits in consuming these food products, but I don't find them necessary. I'm concerned about the anti-nutrients that are present in these things. Are they being prepared the right way? And they're just not required. So if people want to consume these, again, we just help them to consume them in a way that's going to be low inflammatory, that's going to allow them to get the anti-nutrients that are coming out of these things in the best way possible. So last thing, I mentioned that there's a new piece that I'm adding to this conversation around alkalinity. In general, again, I don't believe that the alkaline theory, the philosophy of food potentially having an impact on the alkalinity of your blood, I don't think that it has any merit whatsoever in real life. However, there was a study I saw recently that I did, that I was reading, preparing for one of the videos on this topic, that did change the way I look at this a little bit. The study was great because it controlled for both calorie intake and it controlled for protein intake. And what they showed is that if you optimized calories, optimized protein first, and then optimized for alkalinity, you did actually see a subtle improvement. Now, does that mean that I'm wrong and that alkalinity matters? I don't know that that's true. I think that probably what they're showing is that if you eat a protein-forward diet and then you add fruits and vegetables on top of that, you're going to have better outcomes. But that's what I said in the beginning, which is we need to eat a protein-forward diet that is rich in fruits and vegetables. That's going to give you the alkalinity that you're looking for. So I don't know that it has anything to do with alkalinity, or it has more to do with the micronutrients associated with those nutrient-dense foods. All right, so let's wrap this up with a bow. So the optimal bone health diet is protein-forward, preferably from animal sources, has adequate calories. It is a nutrient-dense from whole food sources. It's rich in tolerated vegetables and tolerated fruits and dairy, again, if you can tolerate it. So that's it. That's all it needs to be. It is not complex, but following it may not be easy depending on where you're starting from. But that's why we customize everybody's nutrition plan based off of their own needs. It's important that whatever you're deciding to do is something that you can actually follow. Before I get to this next section, if you are struggling to put together your own bone health program and you're concerned about some common mistakes that people are making, please come to our Masterclass. Our free Masterclass is a course that we put together. It's done live every couple of weeks. I lead it myself. We talk about the common myths and misconceptions and some potential paths forward if you're struggling with bone health. So if you haven't been to our Masterclass, look for that link in the description below. So remember that a diagnosis of osteoporosis isn't the end, but deciding to reverse it is a beginning. I'll see you in the next video.